Hi, it's Jack Hadley with My Social Practice. Welcome to Dental Digital Marketing Discussions, where we talk about all things digital marketing for dental practices. As you know, at My Social Practice, we're pretty focused on social media specifically. However, we recognize the power of a broader digital marketing strategy that includes lots of tools and lots of techniques and lots of tactics. And so we enjoy bringing in some of the smartest people that we know in dentistry, one of which I've got with us today. I've been looking forward to our visit with Dr. Annelise Driscoll. Dr. Driscoll and I met, it's been a couple of years?
It has.
So
it
now?
has. Yes, it has. Mm-hmm.
Yeah, and I've had the opportunity to go down to Florida twice and visit with her students. And so I'd like to do a real quick introduction. I'm going to share my screen here for a second.
Sure.
And then we're going to get started. So Dr. Driscoll is actually both the director and a professor at the Executive Practice Management Program for Dentists at the University of Florida College of Dentistry. Let me tell you what my view is of this program, and then I'm going to have Dr. Driscoll clarify where I'm not right. But I want to tell her what I've thought about her program since I first heard about her and the program. As I understand the program, and again, I've had an opportunity twice to visit with groups of her students in Florida. This is like many MBA-style programs where a student will graduate, go out into the workforce and work, and then come back and sort of do an executive MBA program. But Dr. Driscoll's program is designed specifically for dentists. And so here are groups of dentists that sign up for her program, and she'll tell us the length of time. I know it's over the course of several months, but she'll tell us the details in a minute. But essentially, they work remotely and they work in person by going to Florida on how to really become good at doing business as a dentist. Please elaborate on that for us, Dr. Driscoll, and let's make sure everybody knows exactly what the program's about.
Well, first of all, thank you so much for having me. This is a privilege and an honor. As you know, I'm one of your biggest fans as well, and so impressed with you. Our program is a unique program. It's a 13-month program, and it really takes the dentist from clinician to entrepreneur and business owner. And it is specific to dentistry. So it's based on the principles and theories and applications of sound educational programs. And so at the University of Florida College of Dentistry, we are so excited to have this program have turned into such a unique, comprehensive, and very fulfilling, renowned program. So it's 13 months, and our dentists fly in from nationally and internationally once a month to the St. Pete area here and around the Tampa area. And they work in groups as well as individually, and can take the information and apply it directly into their practices the next day, Monday. So we work on converting them from just the mindset of clinician, which is great, but if you want to work for yourself, you must be a business owner and entrepreneur. And those are important differences, and that's what we develop in our dentists.
Yeah, well, and it's just so neat because you can have great clinical skills, and certainly the doctors are trained in great clinical skills, but so often they don't get that depth of practice management and the things that you would learn as an MBA. And essentially, that's what you supplement and help them. Of the doctors that take your course, what is sort of the average amount of time they've either been already out and practicing? Are they fairly new graduates? Have they been out working for years and years, decades? What's the average?
Well, when we first developed with the program, we thought for sure that our target market would be newly graduated dentists. And we were very surprised to find out that our cohort members accepted into each cohort have been out for a myriad of years. There are residents all the way up to those who have been practicing for 35 years and still don't really have a full understanding of the business side of dentistry,
Mm-hmm.
and in particular the financial aspect and the marketing aspects. And so we do our darndest to create entrepreneurs out of them, and it has been probably the most fulfilling thing I've ever done in my 35 years in my career. So yes, yes.
Well, I'll tell you the energy, and again, I've only had the opportunity to spend one day twice in the
Mhm.
program, but
Mhm.
the energy in the program and sort of the camaraderie between the attendees as they sort of share their experiences as you teach them, it just seems like a wonderful program. I'm a big advocate of it. So
Thank you so much, and you're
yeah,
such a great part of that success. So
well,
we appreciate you immensely. Thank you.
I love doing it. Oh, one other thing I need to show real quick. Let me share this one more time.
Sure.
So last time I was down there, I took one of our photo booths and we had a little fun taking photos and kind of branding it with your program. And I actually shot just a tiny bit of video on my phone of you and
Mhm.
some of the students in the class there having a little
Yes.
fun and taking some. You're a big advocate. You're a big social media person. I know that.
I love social media, actually. Yes. And I'm a huge fan of our dentists embracing it. And it can be scary and overwhelming, but it is so much fun.
Yeah, it
And
is.
your photo booth, which is really a photo stand, really showed them how easy it was to just get started in doing something fun. And they were so inspired.
Well,
It was fun.
we had a lot of fun doing that. So
We had a blast. We had an
yeah, it was
absolute
great.
blast. So it's got to be fun. Otherwise, it's got to be fun.
That's
So
got to be fun. Leave it at
yeah,
that. You're right.
it's got to be fun. I'm all about the
Well,
fun.
exactly. As our audience knows, and as you know, one of the reasons we do this is we want to talk about three specific ideas. And so, in
Right.
preparation for our visit today, you've sent along three ideas. We like to keep it succinct and actionable and moving right along. And so, as you know, I keep a little timer on my smart iPhone here that counts us
Yes.
down.
Uh-huh.
And you've sent ahead three ideas, each of which we're going to take 4 minutes and discuss. And
Sure.
so let me just introduce the idea, and then you take your time to kind of explain that, and then we can talk a little bit until the timer goes off. How about that?
Okay.
Okay.
Sounds succinct. I'll try
Let's
my
see.
best.
Well, I like the ideas that you sent along. Let me kind of set up the first one. You said that there's been really a historic shift in marketing to our prospective new patients. Now,
Hmm.
4 generations are
Hmm.
using digital marketing, internet marketing, social media on a daily basis. And you listed baby boomers, Generation X, millennials, and now what are often called centennials or Generation Z. So let's talk for
Yeah.
a few minutes about that historical shift.
Well, over the last 10 years in particular, since the first iPhone was introduced in 2007, which is hard to believe it was just that short
I
amount of
know.
time, we've had a tremendous shift in marketing. And for the first time, we have 4 generations of patients and potential patients that use social media and marketing. And so we have to look at this differently now. This fast change has occurred. It's historic that we have over 100 years worth of generations when you combine the
Yeah.
4 into a new potential pool of patients to market to. So we've got baby boomers who are the fastest generation of users. We call them the silver surfers, but they are the fastest generation of users with Facebook accounts. They use the internet for everything, and they have smartphones, and they know how to use them and keep in touch with family and grandchildren.
Yep.
We have the Generation X, which is like myself, that wasn't raised on it, but we've embraced it, and I love it. And then we have, my mother, and my mother's a baby boomer, and so I can tell you that we have her, we have myself, we have my children who are millennials that are using it, of course, for everything, and started later in life. And now we have the I generation,
Yeah.
otherwise known as the centennials,
Yeah.
and they are now graduating from college, and they have never known a world where there wasn't a
No.
smartphone or internet connection. And so that's my granddaughter who
Yeah.
can FaceTime me, who's not 5 yet, who will be next month, who can FaceTime me, and we iPad together called padding, and we Netflix together, and we are playing games, and she knows how to use the App Store. And I mean, that's historic to think that every generation now is subject to digital marketing.
Yeah.
We are digitally marketing to 4 generations.
Yeah, isn't it something that this shift, and what's funny about these newer generations, is especially the last two, is that there's a certain expectation, if I could use that word, that if you're not available and transparent and accessible and easy to get to and online, and the experience is seamless between the physical experience and the practice and the digital experience, there's a gap there that's very noticeable to those generations if you're not present.
You have hit the nail on the head. And I try to explain to our dentists that internal referrals are very important, but those internal referrals will only get you a certain few number of patients, maybe per patient. If we don't have all the areas closed with regards to our digital marketing, we have underestimated the capability to reach patients of significant magnitude and exponential reach. That can't be discounted. It can no longer be ignored. Yeah. So we have to close the loop. You are correct. We have to close the loop and have it seamlessly integrated, which is not difficult. And I think our dentists think that it is difficult and overwhelming, and it's not.
Yeah.
So.
Well, and you talk a lot during the course, when you do the EMP course, about digital marketing and specifically about these tools. I know it's
Absolutely. It is something that most of them have a website at this stage, but it hasn't been touched in years. It hasn't been updated. Many of them have a Facebook page, but it's only used for educational purposes. Mm-hmm. They may not have a LinkedIn page. They may not have ratings.
Yeah.
So we have to.
Yeah, I agree. And I think the nice thing about your first topic there, where you suggested that we talk for a minute about this historical shift, it's a nice segue really into your second idea. And since we're going to stick to the clock, let me introduce the second idea, because it's really a follow-up on what we were just talking about. You said in your second idea that not only is it important to recognize this shift, but you actually need to learn how to digitally market to these different generations. While it's important to recognize all of them, there are some subtle differences in the way that they do engage with the internet. So it's not like there's a one-size-fits-all for every single group. So you kind of have to think of them a little differently while you need to recognize and market to all of them. So elaborate a little bit on what you were thinking of that second point.
Well, we have different markets, different levels of patients that we market to. And so we have to customize our marketing message, our digital marketing message to everyone. If we realize that all of them have access to the internet, they all use the internet, we have to reach them in different ways. So we have to be able to use the one common thing, which is fun, because everyone smiles in the same language. Right. I believe is a quote from Mother Teresa once said that everyone smiles in the same language. And having fun and smiling, which is our industry, we are smile makers, is one of the commonalities that brings all 4 generations together. But at the same time, we need to be comprehensive and have education, fun. We have to have messaging via YouTube. We have to have Facebook. And we have to combine it all. We need our reviews. And we have to look at each one of those segments and realize that, the baby boomers have a longer attention span for Facebook. Mm-hmm. And our iGen, our generation centennials, have an attention span of about 2.3 seconds. So we need to capture them immediately with video and video messaging and have them in a location that's easy to find. We need to make sure that, that everyone is catered to in a different way, but have it centrally localized where they can, see offshoots as well as a message that is based on fun and smiles
Yeah.
and enjoyment and engagement. Engagement is everything. So digital marketing has to be engaging for all 4 generations.
Yeah, and I like you brought up 2 points when you talked about the common thread between all of these groups. You brought up the word fun, and you
Yes.
brought up the word easy.
Yes.
And those are kind of the 2 things that I like to talk about a lot too when we talk about this, because those 2 things are certainly applied to all generations. You can't make it hard to do, and you can't make these things hard to find. And you got to make sure the team, that at least some, if not all members of the team are helpful in making it easy for the patient to be reminded to maybe share a photo or maybe do some little thing or write a review. So
Yeah.
it's ease and it's fun. I think those are 2 really key words you just used.
Well, I have to say that this is going to be a shameless plug for you, but
What?
in my 35 years, which, I started when I was 2, but in my 35 years, your products and your campaigns have allowed this to transcend the difficult areas and it's too hard and I don't know how to do this and I don't know what to post and I don't know how to, I don't know what's going to be engaging. So your campaigns are fun. That's the first thing. Everyone smiles. All generations love to smile. The grandparents all the way down to their grandchildren love to smile. And so the staff loves to smile. Dentistry is a heavy field.
Yeah.
We're a heavy field where nobody hears dentistry and goes, oh my gosh, that sounds so fun. And yet if we make it fun, then patients respond better, employees and our teams respond better, dentists are happier, morale increases, it becomes a more fun workplace. And again, it's easy and fun are 2 key concepts that go with digital marketing.
Yeah. What once in a while I'll get the question, Annelise. I'd like to hear if you got this question from a doctor, how you would respond. Once in a while I'll hear a doctor say, well, we're not that kind of a practice. We're really buttoned down, and a lot of our patients are kind of older, and I just don't know if that fits for us.
I think my main response is that even the older patients, nobody uses the phone book anymore. Every one of them has a smartphone. They all use the internet. And if you don't have a digital footprint and you haven't handed out mind reading hats to your patients, they will not find you.
Yeah.
So if you don't want patients to find you, then I guess you're not that practice.
I like that. That's a great answer. Very good. Make sure that your little microphone, I got a little bit of feedback a minute ago. Is it being brushed up against maybe by something?
I don't know, but is this better?
Better.
Okay.
Yeah, better.
Great.
Just for a second there, it was a little soft.
Thanks.
So
Okay.
All right. So let me go to our third idea. The third idea that you mentioned was a paradigm shift in dental marketing that must not only include social media, but also includes awareness of a strong digital footprint. Can you talk a little bit about what you mean when you talk about a digital footprint?
Well, if I were to go online and search for something, you would pull up your search engine. And so what many of our generations now think about is, what did we do, BG, before Google? Where did we find this information?
Yeah.
So having a digital footprint means what can someone find out about you online? You have to have some kind of a digital footprint. If we're looking for doctors, we're going to look for doctors online, and we want to come up as a particular office wants to come up right away in a search so that patients can find us easily. And then they want to read about you. They want to know about you professionally through LinkedIn. They want to know about you personally through ratings and your Facebook page. And they want to see what your staff thinks and says about you. They want to know about where you went to school. They want to hear about you and see what other social media is available. They want to know what your patients are saying about you. We live and die by reviews.
Yeah.
And whether you have a website or not, patients are still reviewing you through Google, through all different review sites, and through Health Grades and Rate MDs and Vitals and whatever. So either you have a message that you can participate in and contribute to and be actively engaged in and engage patients and create that digital footprint that's positive, or it will happen whether you
Yes.
realize it or not. And so we'd rather have fun and engaged and inspired, motivated digital presence than not. So
Yeah.
it's a big paradigm shift, really big. Mm-hmm.
It really is. I think that many doctors that are dealing with what we're calling new marketing got really conditioned to believing that their digital footprint was basically their website. Because in the early days of SEO, the goal was to optimize that site for search with keyword optimization and a number of other strategies. What's interesting today is that the footprint is that your website's actually a very tiny part of the footprint.
Yeah. Mm-hmm.
And it's the part that you control, maybe have the most control over.
Right.
But yet, this is about steering. I think it's not anymore about controlling the footprint, because you really can't. Other people really control it through reviews and all these other outlets. So you can't control it, but you can steer it.
Absolutely.
And I think what you're talking about is steering that footprint.
You have to steer the footprint. Absolutely. It's very important, because, the old saying that the world is going to change either way. And if you don't change, it's going to change around you and you'll get left behind. So to constantly create a digital footprint that's alive and goes from one dimension to 3 dimension and continues to engage and bring people back, that's critical.
Yeah.
That's the whole point of digital marketing, to maximize it and create these opportunities, is to have people come back and want to come back and see what else you have to say and you're doing, and what your patients are saying and doing. And so, we definitely, it's a 3-dimensional alive concept. It's not 1-dimensional, like a website that just sits there. That'd be, to me, like wearing one pair of shoes every day.
Yeah.
And we need different shoes for different things, and we want different shoes, for people to see, and that's part of the footprint. I don't want the same pair of shoes to leave the same footprint. We don't want one set of footprints. We want it everywhere we can get it, and we want people to be engaged, and that's what digital marketing is. It's a tremendous opportunity to capitalize on 4 generations now that are on the internet every day.
Yeah. And it's interesting that I read an article recently. We used to always do everything possible to redirect traffic back to the website, because it was thought that the website was the conversion point. I think there's still a little bit of truth to that, but I've been reading many thought leaders on this topic who are starting to alter their position, that the important point is to convert. At any point you can convert, and these different age groups that you're talking about put a different level of trust into a website, because they know the website is what you say, it isn't what other people say. So
that's right.
You can't just convert there. You've got to convert in many channels. And
absolutely.
It sounds hard, but it isn't hard. It's more of a mindset. And once you get that mindset and start to expand that footprint and steer it a little better, I think you appeal to a lot more audiences, and there's a lot more opportunity to convert.
There's a tremendous opportunity right now. This is a tremendous opportunity to get and to maximize the patients that we want to be able to convert them to become patients of our practice. And I think of it this way: what kind of message would my mother want to hear through digital marketing? What would she be attracted to? What am I attracted to? What would my kids attracted to? And what's my granddaughter attracted to?
Yeah.
When you think about it in simple terms like that, it's relatable, because you know what your family members enjoy and what engages them. And that's really how simple it is to be able to think about it from that standpoint, to convert them. 4 generations, 100 years, what would they want and need to see and hear about you from a digital marketing perspective?
Yeah.
And all of them involve fun. All of them involve smiling. All of them involve having a great time. So,
well, I like that kind of leads to a nice sort of conclusion, because you've just kind of mentioned an action item, and that is to first recognize the historical context,
Yes.
to recognize you need to talk to these groups and steer that
Yes.
footprint. You've got to make it fun and easy. And also you've said, when you go to do any kind of marketing, take a moment, sit down with the team or in a quiet moment and grab a pad of paper and list the four groups, and then say, what can we do on this digital footprint to touch this group the best? Well, maybe it's a post like this, or maybe it's a contest like this. Okay, let's talk about this group. Let's talk about this group. Suddenly you've got one idea with maybe 4 tactics or 4 executions designed to reach all of these audiences. So I think that's a good action item for those of you that are listening in and want to take away from this. I think you take away that as an action item to follow up in your practice next week.
Yeah, I think it's an easy thing to do. Sit down with your team. Everyone comes from different backgrounds and different experiences, and they all have, many of them are part of 3 to 4 generations, and ask them about how would their family members be able to be engaged and reached, in what way, in what method. And that's an easy way to start the discussion and to get everybody engaged and motivated, and, you know, buy-in in the practice from the team, to be able to think about these easy ways to do this and reach potential 4 generations worth.
Yeah, and I like that you've said probably most practices have a person or 2 from maybe not all 4 generations, but probably 3 of the 4 at least. So that's a good little test kitchen.
It's a great test kitchen. Your team is your most valuable asset. So, you know, they have to help you with reaching patients, and they have tons of information to share as well. So
awesome.
Yeah, absolutely. Yeah.
Great points. Thank you. And
thank you.
And great conclusion. Okay. Now, as you know, in conclusion, we do something kind of fun here. I'm going to give you a test. Our team has prepared 5 questions. As soon as you get 3 of them correct, I'm going to share my screen here. If you get 3 of them correct, you become the winner. Although you do not actually win anything. I'm sorry.
I know, it's a bummer, but that's okay.
You get all the work. And Dr. Stephen Mitchell and his team at Atlantic Family Dentistry, they are going to be the beneficiaries of your great, expansive knowledge and expertise at answering these questions. So if you answer 3 of these correctly, we're going to treat, and my social practice is going to treat Dr. Mitchell and his team to lunch. So you're playing for them, okay?
No pressure, no pressure.
No pressure,
right?
That's right, that's right. All right, ready?
I think so.
Question number 1. Which is the most populous U.S. state? You have 3 choices. Number 1, New York. Number 2, California. Number 3, Michigan.
Wow. Well, I know it's not Michigan. I'm going to guess California.
You are correct.
Wow.
You're 1 for 1. Nice job. Okay. Number 2, according to the old proverb, to which European capital city do all roads lead?
Ooh, is that to Rome?
Yes, look at you. Ooh. 2 for 2. All roads lead to Rome.
Oh my gosh, this is stressful, but thank you. All right.
You even got the geography one. That's the tough one. All right, here's the pop culture question. Which actor plays the role of Captain Jack Sparrow in the Pirates of the Caribbean movies?
Johnny Depp.
Yes, very nice.
Okay. Well,
have you seen the new one?
I have not, but
I haven't either.
I haven't, no, but maybe this weekend we'll see.
So look at you, 3 for 3, right out of the chute, right out of the chute.
Well, no pressure, but if Professor Driscoll doesn't pass the test, it's not a good sign. So reputation-wise.
Well, we will reach out to Dr. Mitchell and his team next week, and on behalf of Dr. Driscoll and my social practice, we'll take them to lunch. All right.
Oh, how lovely.
Okay.
They don't know. This will be a lovely surprise. They don't know. That'll be
wonderful. Good.
Yeah.
I want to put up one quick slide here with your contact information. So those who may be interested in learning more about the EMP program, I think it's awesome. And I think if you are considering any sort of advanced training and education and related to growing your business and running a more profitable practice, I think it's a very unique idea. And you can contact Dr. Driscoll. There's her phone number, her email address. She uses a Gmail address for the program itself, other than it's not her University of Florida address. It's just Dr. Annelise Driscoll at gmail.com. You can go and learn more about the program at empfordentists.com. And anything to add to this slide, Annelise? Is that all the information they need?
Yeah, except for this is my mistake. It's EPM.fordentists.com, and I did not pick up on that. So my apologies for that.
Well, that could have been our fault too. If you look under Dr. Driscoll's photograph there, you can see that it's Executive Practice Management, EPM. We may have made that mistake when our team put the slide together. I'm sorry.
That's okay, no problem. I'm sure it's mine. But that number, by the way, Jack, is my actual cell phone number, and I'm pretty much available most of the time. So people can feel free to phone me at any time with any questions that they have, and it goes directly straight to my mobile. So being available and approachable, as you know, is one of the things that I value, and so I'm always approachable and available.
Good. Mm-hmm. All right, good. So that one little change, epmfordentists.com is the URL.
Thank you so much.
All right, so I'm going to stop sharing the screen. And anything you want to say to wrap up? I think we're done.
Well, other than the fact that I appreciate you immensely, you have made this so fun. You have made this such a great way for dentists to get started if they don't know where to get started, for teams to get engaged. And your products I have been a fan of since day one. And we are just so thrilled that you are part of our program because what you provide is invaluable in helping get them to a place where they absolutely must be these days. So thank you. Thank you, Jack.
I appreciate that. And before we got on air, you mentioned that Dr. Mitchell, that the practice that you played for, I guess he was in attendance the last time I came down and spoke, right?
He was.
Good.
And he was overwhelmed with marketing. And since he has taken this on just in 1 month, he just told me last weekend as I was teaching last weekend with him that it has literally revolutionized his practice. The team is energized, the patients are energized, the campaigns are fun. He's seen an immediate difference, and he is having so much fun at work with his team, and it's just made such a huge difference. That to me is so meaningful. That's so meaningful because that improves quality of life for everybody involved. So,
well, that's great.
Go you.
I'm glad to hear that, and I'm sure a lot of that came from the 13-month program. I mean, he had just gone through a very intense learning experience on how to grow his business and how to better market it. And then I just came in at the end and gave him a few little tools. So it really is probably mostly from you, but thank you.
Thank you. Thank you.
All right. Well, we'll wrap up our dental digital marketing discussion today, and look forward to seeing you next time. And again, much thanks to you, Dr. Driscoll, for being with us.
Thank you so much for having me, Jack. Appreciate everything you do.
Okay.
Have an amazing day.
Thank you. You too. So long.
Take care. Bye-bye.